if this video can inspire someone or just to pick up the phone and inquire about something and take that first step towards the help they need, then it's done its job. That was at the top of Church Hill, and that overlooked where I grew up as a child. It just brings back memories of my youth at a more innocent time when things were easier and everything was fun. Everything you did was fun. Managed 4 months at college, and then I had to find a job. I found a job as just a general labourer. After a couple of years of that, I found a job at Bingo. I stayed there for a long time. Worked hard to get to where I was. Everyone trusted me. I trained people, interviewed people. Then I found a job at PricewaterhouseCoopers, and that was scanning and doing document management. I spent a couple of years doing that, but then the management increased the targets. So I had pressure at work with targets that I couldn't reach because my typing skills weren't that good. And when I got home, I had the bills and other debts that I couldn't pay off. So I had like pressure and that at home. When my flat started to become in disrepair, that brought my mood down even worse. And in February 2010, I had a depression. I lost 3 stone. My mood was really low. I mean, really, really low. I had negative thoughts. I went to the GP, told him everything. And he said, right, what I can see is you are in a depression at the moment. I was then put on antidepressants. I went back to work in October for a couple of weeks, but I went back too soon, and then it got to me really quickly, and I went off again with serious depression. I was sitting in my flat. I closed myself off. I turned my phone off for 2 months, wouldn't answer the door, didn't open my post. My life was literally wake up, sit down, put the computer on, play a game, just to take my mind off the negative thoughts, and then go back to bed. And that was my life. And that's when someone from HR called me, asked me how I was. I told them that I was having thoughts of ending my life. At that point, she called a doctor. The doctor turned up at my flat. He saw how bad I was, and he got the crisis team involved. The crisis team stepped in and was seeing me 3 times a week. After the crisis team had seen me for a few months, and they were happy that I wasn't going to act out anything that would harm me, they passed me on to a community practice nurse, and he saw me once every 2 weeks to start. After that, he put me in touch with Samwell Mind, what they were called back then. It's now Kaleidoscope. They sent Justin and Mary to interview me to see if I was right for their team.
Lee was really, really low, very depressed. I think everything had become too overwhelming for him, so he was just existing rather than living. Myself and Justin, one of our SDR workers, went out to assess Lee at his property, and he spoke to me on the intercom, and he said he didn't want us to come in because he was embarrassed. But I did ask him, would he please let us see, because I could help him better if he allowed us in to see how he was living. The property was very cluttered, and it was in disrepair. It was very damp.
They turned around and says, yeah, you are 4-hour team. And then Justin took me on. He was the major part in helping me forward.
Justin went and talked to Lee about how he wanted to address what was going on and what needed to be sorted out first. Justin helped him an awful lot in getting rid of all the rubbish and also sorting out his financial situation, liaising with the council because there was leaks, there was drips and damp, and there's lots of repairs needed doing, and just general emotional and well-being support as well.
It was like a big weight lifted off my shoulders, knowing that there was someone there who could come in and just help me out a little bit here and there and say, you know, you're doing well. And he was constantly complimenting me on how well I was doing, even though I couldn't see it, even though it was just like, okay, I've managed to clean this little bit. He would compliment me, he'd say, well done, you know, you've done this, you've managed to do it. And just that little compliment gave you the inspiration to do a little bit more. He then got Jim involved, who worked at Parkside, which is supportive housing. As soon as a flat became available, he said, right, we're moving you in now.
When the first available flat came up, then that was offered to Lee to come. And he was quite low, quite depressed, didn't really know how to manage a flat well because the standard of the flat before was so poor that I think he just lived and just kind of got by day to day as best as he could. So moving to Parkside Place, he had a chance to have a nice environment to live in and then to learn all the independent skills that he needed to live.
With a really nice environment, it started to lift me up a little bit. They were basically helping me relearn skills that I might have forgot or didn't know.
I think with Lee, because he didn't have access to cookers or fridges, we did basically learn from scratch with Lee. That's how we started, lots of one-to-one little basic cooking skill sessions, managing finances, putting a healthy meal together. And Parkside Place really encourage people to be part of the community and stop the isolation, because that's what we feel really does lift people's moods and improves people's mental health, is not to feel alone, not to be stuck in a flat by themselves. So it was making Lee feel comfortable and feeling like this was his home and this was his little community, really.
They were a big support, and I was there for a year and 5 months. While I was at Parkside, Jim, he was the one that suggested to get a volunteer job. Volunteering is the way to get me out of the flat and meet people.
So Lee really was an ideal candidate for that. He'd been through one of our services, he'd worked with on a volunteer basis for us, and our vacancy became available, which he applied for, and he was successful in gaining.
So when the job was posted, I applied for it, did a really good interview and got the job. Now I'm a full-time administrator for the Confidence and Wellbeing team.
To provide services of the natures that we do, I think you need to be empathetic, and if you've been through that kind of situation yourself, you are more likely to have that empathy for somebody.
That's my journey from 2010 to 2014. Went from serious depression to where I am today. I didn't realise that there was so much support out there, because I'd never been in that situation before, so I'd never looked into it. I went through the crisis team and the CPN, went through Samwell Mind, which is Kaleidoscope now. I went through PIM, and now I'm in Confidence and Wellbeing. You know, I've been through everything now, and I now know that if people need the help, we are there.
I'm very pleased and I'm glad that we've been able to support him on his journey. I know that Lee had the skills in the first place and he just needed to refine them, and with the support of the Sort Service and Parkside, he's managed to achieve and get back on track.
When he first joined our services, he was very quiet. And it would be quite difficult to start a conversation with him, whereas now he's very kind of open, he's very forefront, and he'll start that engagement with you rather than you having to sort of initiate a discussion with him.
Seeing people progress and improve and just to be happy and to have a quality of life, that's the greatest satisfaction I think all of us as workers get, is from nothing to, I don't need you anymore, I'm ready to go, I'm ready to leave.
I suppose it's always going to be there, knowing that I've been through it, knowing how to manage it, and being in the situation where I am at the moment, I know that if there are any problems, Kaleidoscope are right here and they will help me in any way possible.